Welcome back. We're talking about hepatitis C, and we're joined again by Dr. Edie Alfano-Sopsi, epidemiologist with Wake County. Now, Dr. Edie, as we've established, that's what I'm going to call you because that's my name for you.
I like Dr. Edie.
I know, right? When we talk about hepatitis C, and you say some people don't know, how common really is it? You know, you said the numbers have gone up, but how common is it?
Well, about 3 million people are walking around with hepatitis in this country right now. 75% of whom are baby boomers, born between 1945 and 1965.
Yeah, we were talking about that the whole baby, you know, I alluded to that in my open, that baby boomers need to be, I guess, more cognizant of the fact that this could be a problem for that. Why is there a particular focus on them?
Well, as I said, about 75% of those are baby boomers. And we don't have a complete understanding about why it's so prevalent in baby boomers. But there are some things that we do know. We do know that in the 70s and 80s, the virus was circulating at high levels. We didn't know it was circulating, but it was circulating at high levels. The other thing is, we didn't start testing our blood supply for hepatitis C until 1992. And so those who received blood transfusions or blood products could have been exposed to the virus. And lastly, honestly, we did not have good infection control procedures that time to prevent transmission from medical equipment and in healthcare facilities. We have much better infection control procedures now and an understanding of how bloodborne diseases are transmitted. So, those are some of the thoughts about why there are so many baby boomers. And of course the usual risk factors that some, not all, had during that time with injecting of drugs.
Yeah, and that type of activity. And there was a lot of that going on, you know, during that time. A lot of things people didn't know. You talk about baby boomers. Are there other groups that are at risk, or they are the highest level because of their age group?
Well, IV drug, anyone who injects drugs are at high risk.
Are people with any blood illnesses at all? I mean, because I think about, you said it's transmitted by blood. Anyone with blood illnesses, would that make them more susceptible, you know, if they had some type of a bloodborne illness?
Well,
and then they came in contact with someone or did, you know, unfortunately
those who are HIV positive are also at risk. So
that would be a double shock to their system with both of those. And you did say it is possible for folks to have it and not know it. So what would you tell people? Just go, you're in this age group, just go get tested?
Yes.
Really, just, you know, whether you feel good or not?
Yes, because many people, as I said, they don't know they have it and they feel fine and there's no symptoms.
Wow. So. Is there because I mean that's concerning to a lot of people. I know people in that age group who, you know, probably have no idea. But the good thing is, though, it is treatable. That's,
yes,
you know, how can, you know, you find out? How can residents, how can people, especially in our Wake County area here, go and find out? Would they think, okay, I was born between these years. What are the years again?
1945 and 1965.
Right. The baby boomers between those age groups, those birth dates, say, well, I feel fine, but let me go check just to be on the safe side. How can they go do that?
They can go to their provider and ask to be tested for hepatitis C, or they can come to Wake County Human Services where we're offering free hepatitis C testing from now at least through September.
That's you took the words right out of my mouth. So there are a lot of people who may not have, you know, the health care that they need or the resources. So the free testing, how long has that been going on? That's wonderful.
We initiated that this fall with some grant money that we received for that purpose.
Wow, is it? I don't know if you want to tell me how much, but it's probably quite sizable, I would imagine.
Well, it's enough to carry us through at least the fall.
That's a long time.
Yeah,
that's a
and
good
so we started in October to our health department has been doing testing for hepatitis C all along, but we were only able to do it for certain groups, which is called targeted testing. Those who were HIV positive or those who had a history of past or current IV drug use. But with the money that we got through our Gilead grant, we were able to expand and enhance our testing and offer it to the community for anyone who has any of the risk factors, and including the baby boomers.
Is the Gilead grant that you mentioned, is that particularly for Hep C, or is it for any type of, diseases of a certain nature? Or?
It's mostly to enhance our testing and linkage to care.
Wow, sounds great. You said there is a treatment. Is there also a vaccine?
No, not for hepatitis C. There's no vaccine for hepatitis C. So the best way to prevent it is to avoid the high-risk behaviors.
Yeah, well, that goes for a lot of things, absolutely.
But some people get confused because there are two other kind of hepatitis diseases, hepatitis A and hepatitis B, and there are vaccines for those two.
Wow. Now, what is the difference? We have a couple of minutes before we go to the break. What is the difference between A and C and B?
Well, hepatitis A is transmitted through contaminated food. It is not bloodborne. And some people get confused with that. Hepatitis B and C are exposure to contaminated blood. And they are not hepatitis C is not transmitted through food or water or touching someone casually.
It's so interesting to me. The food, and I'm going to go to break, the food-borne, or rather the food-transmitted one, hepatitis A, is it you said it's been infected with, or it's been, is it just food that's spoiled? Is it food that has some type of bacteria on it?
It's food that was contaminated with fecal matter containing the virus.
And that's the one we always hear about. That's why if, unfortunately, if you're in your pool, a kid, unfortunately, a little baby gets in the pool and does what they're not supposed to do, and you have to clear it, and then they have to, the health department comes out and takes care of all that because of that type of hepatitis. And that is the one we hear about, God forbid, and they tell you to wash your hands. So I understand. There was actually an outbreak when I lived in Virginia, where the state epidemiologist had to come to this restaurant because none of the employees were washing their hands, and there was an outbreak of hepatitis then. So now we know the difference in that. We're going to talk more about this because it's so interesting, and the fact that people don't know they have it, that is the frightening part, and we do need to do something about that. When we come back, we'll find out about a link between hepatitis C and opioid use.